Good afternoon, everyone, and thank you for tuning in for today's COVID-19 update. Yesterday, I reported that Central Georgetown continues to be the epicenter with the positive cases identified coming from the following communities. In the north of Georgetown, Kitty, Sophia, Turkine, Liliendal, Cummins Lodge, Albertown, and Cumminsburg. In the south of Georgetown, Border, Lamaha Park, South Rheinveld Gardens, and Thirst Park. Today, I wish to add the following communities: Campbellville, East Rheinveld, Guyhock Park, Lodge, Allboystown, and Ling Avenue. Fellow Guyanese, I hope you have noted the areas listed and realize how close the coronavirus disease is to you. So I'm therefore appealing to you to change your behavior patterns and adhere to the guidelines provided to enable us to stop the upward trajectory and help flatten the curve. If not, we will have a situation beyond our control. I repeat, if not, we will have a situation beyond our control. For today, we are reporting 4 new cases, bringing the total number of confirmed cases to 82. The number of persons recovered thus far has increased to 22. However, we have recorded another COVID-19 death, bringing the total to 9. 579 persons have been tested, of whom 497 are negative. There are 2 persons in our COVID-19 ICU, 18 in our institutional quarantine, and 51 in isolation. To date, the number of patients seen in the COVID-19 ICU is 24, with 7 deaths being registered within the ICU. The global report for today is as follows. According to WHO, there are 3,018,681 confirmed cases, with 207,973 deaths. In the region of the Americas, the number of confirmed cases is 1,213,088, with 62,404 deaths. The Ministry of Public Health, from the inception of this pandemic, invited you, yes, you, and you. We invited the Guyanese public to be a part of the fight against COVID-19. As the efforts continue, we will be providing a platform to receive further feedback from you on how we can improve our efforts in this fight. The ministry has partnered with Unicef on the creation of this platform. With me today is Ms. Sylvie Foyer, the Unicef Guyana Suriname country representative who will provide further information on this initiative. Ms. Foyer.
Thank you, Honorable Minister Lawrence. Good afternoon, all. I am Sylvie Fouet, the Unicef country representative for Guyana and Suriname. Today, we really have a collaborative efforts to support the fight against COVID-19. UNICEF has activated this L3 Declare Emergency Operation and support all efforts in Guyana, particularly health, water, sanitation, and hygiene promotion that are critical to fight the COVID. Education with distance learning and safe school, protection of children and families, in particular access to continuous services under very extraordinary times. Today in particular, it's engaging with you, the communities, in risk communication, and communication engagement will entail a CAP survey for the COVID response in collaboration with the Ministry of Public Health. CAP, knowledge, K, attitude, A, P, practices. The survey will be conducted every 2 weeks, twice a month, will cover all 10 regions, so nationally in Guyana. We combine methodology. The survey is conducted by phone, so some of you will receive a call to your home. Online survey, you may receive an email asking you to complement this survey, or piggybacking on the amazing work the health worker, the healthcare, the social workers, and community counselor are doing, and asking you questions face-to-face in the hinterland region in particular. Persons can go to UNICEF or the Ministry of Public Health websites to take the survey during the 1st and the 3rd week of May as well. The idea will be to at least get over 63 persons in particular to have been chosen randomly selected and contacted to have a methodology that is at least 99% confidence, give us a confidence level with 1% margin of error. If we have more, we'll be happy to. It will be conducted by trained personnel and they will not take more than 10 minutes of your time. The interviewers will not ask money, supply, materials, or any other resources. It's only about information, but this will remain also very strictly confidential. And the information will only be used for this purpose of the survey. While participation is obviously voluntary, if you do so, participate in this survey, you will help everybody, your family like yours, to stop the spread of COVID pandemic. So really, please do your part, be blessed and stay safe.
Today, we continue the conversation with you on the impact of COVID-19 on our most vulnerable populations. I have with me Ms. Anne Green from the Child Protection Agency. Ms. Green is attached to the Ministry of Social Protection and is here today to share tips for coping during the COVID-19 pandemic. Ms. Green.
Thank you, Minister Lawrence. Good afternoon. I am Anne Green, Director of Children's Services and Head of the Child Care and Protection Agency. And I will be talking to you on assisting children and families to cope with the pandemic COVID-19. The threat of COVID-19 presents daily challenges to the well-being of children and families. Parents, caregivers, and guardians suddenly become responsible for managing the children's education due to school being out and to cope with the other challenges with the necessary imposed partial lockdown, which may include a lack of adequate resources for the sustenance of the family. Coping with these have resulted with increased tension and anxiety in the home. It is also understandable that with everyone being at home together, some conflicts are unavoidable. But how families cope will have a great impact on the children. Parents are anxious and many are having difficulty coping, resulting in frustration with the children. Parents need to manage our anxiety. Some quick tips how to do this. When the going gets tough, too much, step away. Take a break. Go into another room or step it outside into the yard. Take deep breaths or a quick shower. Watch your social media exposure. All the doomsday information you are receiving that set you thinking about the world is over. Getting information is one thing, but being over-informed or exposed is another thing. This can cause anxiety that is inadvertently passed on to children in the home. The CPA has a response WhatsApp group, and a couple of Sundays ago, I had to put a halt from all the unnecessary tweets, the doomsday tweets, and ask everyone to send something to make us get a good laugh. Humor helps. Try creating structure in the home. It is said that it is easy for children to get bored or fretful if they are facing a day without structure. A day without structure is a setting for anxiety to thrive. Alternate chores, schoolwork, periods of free time. A parent told me she was having her children dressed for school for the teaching sessions at home. Do things with the children. Bake, play a game of Ludo, start a kitchen garden. Be creative about new activities. Keep children in the loop. Inform about what is happening, but keep it simple. Remind children of the things that they're doing to take care of themselves. Washing hands, staying indoors, etc. Screen time for children. Television, iPods, and tablets. The experts say that the rules can relax a bit since the children are at home with no school. A little longer viewing time will not do harm, but it's a no-no for children under 2 years old. Generally, what is needed is to create a secure home, a safe place, and this is done by being predictable and consistent. This is achieved by being responsive, by being nurturing and affectionate, by modeling confidence and thoughtful problem solving. Children are known to be resilient, and they seem to be able to cope better than the parents and guardians. But how they come out of this depends on how we, the parents, cope. This brings me to violence in the home, family violence, child abuse, and domestic violence. In some homes, these were ever present. And now with all the parties having to be consistently together, the abuse has escalated. So we have to be our neighbor's keeper and watch out for children and families and call the Ministry of Social Protection hotlines. For child abuse, the number is 227-0979. For domestic violence, 227-0206. You can also call Help and Shelter, toll-free numbers 613-1758 and 613-1811. We can beat this if we are responsible, keeping the physical distance, wearing a mask when out in public, and wash hands as often as possible. Take care, be safe, and know we at Child Care and Protection Agency are there for you. We are just a phone call away. Call us on 2270979 if you need guidance and assistance. I hope that these few guidelines will go a long way in helping you to cope with the children and dealing with the stressful situations. Thank you.
Thank you, Ms. Foyer and Ms. Green. As the Ministry of Public Health continues to respond to the COVID-19 pandemic, we recognize that providing coping skills for our children and their parents are pivotal to maintaining their mental health and wellness during this stressful period. We do hope that you will make use of some of the activities that Ms. Anne Green suggested to help ease the anxiety that you are experiencing. Please remember to take part in our survey as outlined by Ms. Foyer. So, my fellow Guyanese, why don't you give your neighbor or a friend or a family member a call? That small act can certainly bring relief to someone under duress. Further, remember to stay home. If you must venture out, wear your mask. Observe the social distancing guidelines, as well as the cough and sneeze etiquette. Stay safe. God bless you,